name is Providence, and I talk about everything about Oski and the journey to the UK. So, if you're an overseas and you're looking to live and work in the UK as a nurse, you're welcome to the right channel. So, sit back, relax, and I will tell you everything that you need to know. So, for today, I'm going to be talking about the Husky. Some people has asked me to tell them everything about the husky. They want to know more about the husky, so this video is for you. I'm going to tell you everything that you need to know about this husky exam. Okay, so sit back, relax, and let's get to it. All right. Okay, so the husky is the objective structured clinical examination. Okay, it's like the practical to the CBT exam. So it's practical to the CBT exam. All right. So the OSCE is a test of competence that is organized by the NMC UK since October 2014, and it's just a requirement for pre-registration for you to practice as a nurse here in the UK. You will have to get this OSCE exam and get your pin. Okay, is into different categories: the adult nursing, the learning disability nursing, the midwifery, mental health. But for the purpose of this class, I'm going to be discussing only on the adult nursing or skill. All right, so what will it be tested on? The OSCE is designed into stations. Okay, we have the scenario-based stations, the silent written stations, and the skills stations. The scenario-based stations it's called the API. Okay, the A stands for assessment, P stands for planning, I for implementation and evaluation. All right, so but for the old test of competence or ski, that's the legacy or ski. You have 6 stations, 4 of the scenario based stations, and then 2 skills station. But for the new test of competence, new stations has been added to the previously 6. So instead of 6, you'll be getting 10. Okay, and the API station too has also been modified a bit, but all the same, it's still simple. It's something you can get. So for the silent stations, for the new test of competence, the talk 21, you be they added things like the professional values and evidence-based practice. In this station is a silent written station. Okay, they're going to give you like a scenario where you'll be assessed on your professional values. For example, if your colleague, if you see your colleague post a picture of a patient in social media, how would you apply your professional values? How will you handle this situation? So it's things like that you'll be asked. But not to worry, something very easy and simple. I'm going to make separate videos on each of the stations and everything that's required of it. Okay, all right. Same with the evidence-based practice. All right, so the assessment stations, that you'll be assessing a live patient. Most sometimes you can give you a mannequin due to the COVID, so you'll be using a mannequin. So if you're giving a live patient, you're in assessment, that's where you're assessed on your ability to communicate with the patient. Your communication matters in this way. But communicate with the patient, you check the patient vital signs, the how you take the vital signs safely and appropriately, using the 6 C's of the 6 C's: the care, compassion, communication, competence, courage, commitment, communication. This is very important in everything you do in nursing in the UK. As long as UK nursing is concerned, this 6 C's is very, very important. Even when you're looking for job, you're doing the job interviews, any exams you write, they're going to ask you questions on these 6 C's. So if you have done the CBT, you should be familiar with these terms. So you're going to be assessed, okay, based on these 6 C's. Also, for the new test of competence, you're going to be doing the A to E assessment. You're going to do the airway, the breathing, where you will do your vital signs, your BP, your blood pressure, your pulse, temperature, respiration, and SpO2. You want to check all that. You check for disability, you check for exposure, Okay, that's what all check, and then you document, then give health education during the assessment station. Now moving to the planning. The planning is a silent written station. That's where you're going to do your nursing care plan. Okay, you're going to develop two relevant nursing care plans. All right. For example, if you assess a patient during the assessment and you find out that your patient is in pain, then you know that pain is one of your nursing diagnoses. So in the planning station, you go to write the nursing diagnosis, you give the aim of care, okay, then you write down your interventions using the acronym EMATARID. EMATARID is just an acronym to guide you in getting formulating a very good nursing care plan. Even if you don't know what to write, then you identify at least three patient self-care. Is very important, at least three to pass. So that's what the planning. Then for the implementation, that is where we are going to give you a medication. And this scenario based station, they're going to use one particular scenario from the assessment to the planning to the implementation and evaluation. Okay, if you are given a topic in the assessment, that's what you're going to use all through the scenario based stations. So for the implementation, for example, you got a case of CCF in assessment. So in the implementation, you're going to give medications related to CCF, for example, the furosemide or digoxin. All right. So and what you're doing, the plan in the implementation, they're going to assess the way you safely administer medication to your patient. You're going to avoid that medication error. They're going to assess if you're following the rights of medication, you're ensuring safety in giving medications, it's everything. Okay, so here you're expected to check for the expiry date on medication. Make sure that the expiry date is still valid. Okay, and then you cross check the patient's name, and or you check for allergies. You read out the prescription sheet, read out everything. Okay, and then safely administer your medication to your patient after you've assessed if your patient is able to swallow. All right, so moving on to the evaluation. Evaluation is also a silent written station. All right, in this station now, you're going to have access to your documents you use for your assessment, your planning, your implementation. Okay, in this evaluation. So it's just like you're going to write when you do a care plan, when you develop your care plan, you need to evaluate if your patient, how far your patient is healing, or if you can give medication, how the drug is working. If patient was in pain during the assessment, here in evaluation, you want to monitor the progress of the medication you've given, or the level of pain at this time. So but in this case now, you go to get your nurse interventions that you use for your care plan. Okay, now that's what you're going to use for the evaluation. But not to worry, I'm still going to make a separate video on each of these, all right, so that you will know how to write it. But like I said earlier, this is just a brief overview of everything. So now let's move on. Now the OSCE exam, as you all know, is being updated. Okay, as of last year July, the legacy CBT, okay, was modified, and the talk 20 word was introduced from July last year. So but if you did the old CBT, like if you did your old CBT before July, or before July ending of last year, then you're expected to do the old OSCE. But if you did your CBTs after July last year, you're going to have the new OSCE. Okay, but by August this year, there will be nothing like old OSCE or old CBT. So if you did your old CBT, try and make sure you do your OSCE before August this year, because if you didn't do it after August this year, you're going to do the new OSCE. So by August, the old OSCE and the old CBT will be phased out. All right, so try everything you can to do your OSCE before the August of this year. All right, and if your CBT should expire today, you're going to do the new CBT again. Okay, so good luck. One more thing, we have three centers that provides the test of competence. Okay, they have the Northampton, the Ulster, and the Oxford Brooks. Okay, but by this year, they're going to add extra two centers to this school, so you're going to have enough option. Okay, Now, how do you prepare for the OSCE? When you've done your CBT, you've passed your CBT, congratulations, you're good. You're good to do your OSCE. All right, you go to your NMC portal. No, you check your mail or sent from NMC. You have to you check the test providers website. Go to your preferred center. You have to email them, tell them you're ready to write the CBT. They're going to send you some questionnaires to answer, to fill, for them to know if you've been certified to write the OSCE exam. Now they will reply you, and then sorry, they will reply you, and then minute they will provide you with the available dates we can book your OSCE. So just book your OSCE, and then you're good to go. Then you have access, once you pay for your exam, you have access to their online learning portal. So for each test center provider, they have their online learning platform, so you have access, full access to it. And if by any chance that you're unable to meet up with your exam date, yeah, there's a refund policy. If you give them up to 3 weeks notice, okay, you have a full refund. But if you give them less than 3 weeks notice, you won't be able to get your money back. But while you're booking for us, you have to make sure that everything is already in place. Okay, give enough time for your visa application and all, because the visa can take up to 2 months before it comes out, so you give it enough time. All right, so let's move forward. So we've talked about the scenario based station, we've talked about the silent station. Now let's move to the clinical skills. Some of the skills that you'll be tested on are not limited to the administration of inhaled medication. Okay, blood glucose monitoring, this for the new OSCE. Aseptic non-touch technique, ANTT, this is wound dressing. All right, catheter specimen of urine collection, fluid balance, BLS, insertion of nasogastric tube, intramuscular injection, IV injection, visual infusion phlebitis, midstream specimen of urine collection stroke urinalysis, pain assessment, pressure area assessment, peak explorative flow rate, subcute injection, and wound assessment. All right, these are stations, and they are all time. They're ranging between 8 to 15 minutes for each station, so it depends on the one you get. So you need to work extremely hard to make sure that you finish your procedure within the required time. Okay, now the okay, all right. So while you're preparing for your OSCE and when you come to write your exam, what are the documents that you're required to come along with? Once you've booked and you've come for the exam on the day, you're expected to come with your passport, your original passport, your police clearance. So if you're coming from Nigeria, make sure that before you get to the UK, you do a police clearance. That's what you come with to the UK, because you're going to present that to your to the exam. It's part of the ID check. So your passport, your police clearance original copy, your degree certificate, if you have BSc, your degree or diploma certificate, your original nursing certificate, not notification, original nursing certificate. Okay, if you're already in the UK, you have to come with your DBS certificate.